Good morning, everybody. Welcome to my office. I'm joined here today by Paula Tesoriero, Chief Executive of the Ministry of Disabled People, Whaikaha. We are here to release the independent review of the disability support services led by Sir Martin Weavers. The review was commissioned in April to assess the stability of the disability support system and to receive advice on what could be done to address the financial pressure it is under. What the independent panel found is troubling. Disability support services in New Zealand need urgent attention, with unsustainable costs and spending across the system and a lack of fairness and transparency around what disabled people can access. It's a real postcode lottery at the moment, with huge variation in the quality and consistency of support that disabled people are getting in different parts of the country. The review found that much of this comes down to the way the Ministry of Disabled People, Whaikaha, was established under the previous government. Its setup was rushed, which saw poor financial controls in place, inadequate monitoring of expenditure, and a lack of public sector disciplines and operational practices that were needed in a government agency responsible for delivering over $2 billion worth of services. Numerous risks were identified during the ministry's planning, and they were not adequately addressed, leaving it ill-prepared from day one to deliver on promises that were made to the disability community. As a result, the reviewers have told us the ministry is likely to breach its $2.6 billion budget appropriation this year unless we take urgent action. The last government created Whaikaha while it was restructuring the health system during a pandemic and didn't take the time to get it right. Our government will build a fairer, sustainable support system that delivers better outcomes for disabled people based on need. Funding isn't the issue here. We provided a record $1.1 billion funding boost to disability support services in Budget 24. This is a system issue. We need to act fast to get the right financial controls in place. So we have accepted the review's 7 recommendations and will give effect to them by taking the following action. From October, the Ministry of Social Development will become responsible for delivering disability support services. The Ministry of Disabled People, Whaikaha, will be upgraded to a standalone government department responsible for leading work to improve the lives of disabled people through policy advice, monitoring the effectiveness of services, education, and advocating for positive change. A task force will be established to lead the transfer of disability support services to MSD, as recommended by the review. Indicative budgets and monitoring of needs assessment and service coordination organisations, or NASCs, will be reinstated. Funding for residential care and service providers will be maintained at the 23-24 levels while a rapid review of pricing is conducted. And the expansion of the Enabling Good Lives approach will be paused to make sure access to support is fairer and based on need, not location. We won't be making any decisions regarding eligibility criteria for flexible funding until later this year, after consulting with the disability community. Their voice and insights will be so important in getting this right. I appreciate that these are big changes to the disability landscape, but I cannot stress this enough to disabled people across the country. Nothing will change overnight, and nobody's support will be cut off. This is a fresh start, and it's a chance to get things right, to get spending under control, and to address the long-standing problems that I've been hearing about in my many meetings with disabled people across the country. We can and we must do better for disabled people, their families and carers. I want to put on record my thanks to Sir Martin Weavers, Leanne Spice and Reverend Murray Edridge for their work on the review. And now I'm going to hand over to Paula for some comments.
Thanks, Minister. Mōrena tātou. I want to begin this morning by acknowledging the years of work disabled people who fought to have an agency set up to focus on improving outcomes for disabled people. I also want to acknowledge my more than 250 staff and my leadership team who continue to work tirelessly to support disabled people and their families. The review never questioned their dedication, and I thank them. It is a privilege to lead Whaikaha, the Ministry of Disabled People, and to be the first disabled chief executive of a public service agency. The review acknowledges that the past 2 years have been enormously challenging. We had a huge task to turn around decades of issues. I didn't get as far as I wanted, but I am proud of what we achieved. The opportunity now is for disability support services to have the backing of a larger, more established organisation. It is really important that we focus on building a solid, sustainable system so that disabled people, families and carers can rely on it with absolute confidence. I welcome the announcement to establish a powered-up, standalone agency where we have the opportunity to really drive change for the more than 1 million disabled people in New Zealand. The Ministry will lead strategic policy, be a source of government information and advice, provide system-level monitoring, and help bring about societal change for disabled people. We will focus on helping remove the many barriers that disabled people experience. There is much work to be done. We all have a responsibility to make lasting change for disabled people in New Zealand, and I'm looking forward to helping take all of this work forward. Ngā mihi.
Thanks, Paula. Now I'm happy to answer any questions you've got.
How much were they going to overspend the budget by?
Well, it was potentially a large amount, and that's why we've taken urgent action to make sure that doesn't happen. I think the reality of the independent panel has shown that the lack of financial controls has meant insufficient visibility about what's been happening with the spending, and that's what we need to get under control.
Was it 65 million? Was it
More,
potential overspend? Was it
for this financial year,
Yeah.
150 million.
150? Right.
Yeah. So, what we're doing here is, as Paula has said, the challenges have existed for quite some time. It was really unfortunate that when the previous government set this ministry up, they did it knowing those challenges, knowing risks, and actually didn't put the time and effort into resolving those issues. That's what we're doing now. We need to make sure that disability support services are fair, that they're consistent, and people can rely on the services that will be delivered. And that's why we've taken urgent action today.
Minister, is this the end of a disability support service run for and by disabled people? This is going to MSD effectively.
Yeah, so as Paula said, there's 1 million New Zealanders with disabilities. The new standalone ministry, so instead of it being inside MSD, it'll be standalone, it'll be powered up, it'll have a much stronger voice for the 1 million disabled New Zealanders. The disability support service that currently serves 50,000 people, we need to ensure that is stable, that it is operating within financial constraints, and that it's fair and consistent, and that's what these changes are.
How many people will be at Whaikaha now? I understand it will be less than 50.
Sorry, I missed the first part of your question.
Stay at Whaikaha
So that work needs to be undertaken, but my expectation is if you look back over years, we haven't delivered well for disabled New Zealanders. We don't have great enough access to mainstream services, whether it's across education, whether it's transport, whether it's employment. I've got very high expectations about what we need to do collectively to improve the lives of disabled New Zealanders. And so absolutely, we expect to have far more input and greater advocacy for the disabled community. And the other thing I want to make clear is that the recommendations around flexible funding, no changes will be made to those without involving disabled people. I'm very clear about the impact that the March changes had, how distressing they were, and that will never happen again under my watch. We will ensure that over the next 6 months we are looking at the options. The task force will progress that work, and we will consult with the disabled community to ensure that any changes do ensure the additional funding that we have put in gets to those with highest needs.
Have disabled communities been consulted with about these changes?
Yes, so over the last couple of months, I've worked incredibly hard meeting with disabled people, carers, family members, disability support providers, the organisations that represent disabled people, to really listen and understand what they see the challenges are with the disability support service. And they would tell you that it's long-standing. They had very, very high expectations when the ministry was set up. And I feel incredibly frustrated with them that it wasn't set up well enough to be successful. And that's why we're taking urgent action now.
Just to Glenn's point, how many jobs at Whaikaha are likely to be affected?
Well, we expect, because the Disability Support Service will move into MSD, a large number of the team will move with it. But those final decisions are an operational matter, and they'll be worked through in the coming weeks and months.
But there will likely be job losses.
I can't say for certain, but that work will be done at pace.
How much responsibility lies with the executive team at Whaikaha for the mess that the ministry is in? I mean, you say it was set up to fail, but there was a big, strong leadership team in Whaikaha. How much responsibility do they, and should they be taking for this?
Yeah, I think it's pretty clear that the ministry wasn't set up well. I think it was grossly unfair to set up a ministry like that, where the government and the ministers knew the risks, they knew the financial challenges, they knew the complexity that had existed for many years, and they ploughed on regardless. So I think Paula and the team have done the best job possible in what was, quite frankly, a mess. And they did the job as well as they could in the circumstances. I'm actually unwilling to let it continue, which is why I've made this change. And I think the Disability Support Service, by being delivered by a larger government agency that has those financial and commercial systems and processes in place, will mean that can be delivered well and better for New Zealanders. And equally, disabled New Zealanders need strong advocacy. As I said, there's lots of challenges that they face on a daily basis that many New Zealanders would have no idea about. And we must make progress. And I'm really confident that having the ministry standalone makes a really important signal that actually they're not just tucked inside MSD. They are a standalone agency. We want them to do well to ensure that we collectively improve the lives of disabled people.
So do you have confidence in the executive leadership team? Will Paula Tesarero keep her job?
I do have confidence in Paula. As I said, I think she has done a very challenging role, and I think it was really unfair of the previous government to set up a ministry in the way they did.
Where was MSD in all of this? Because they are the appropriation administrator with oversight over the spending. Did they raise red flags? Where were they?
So there is a very clear line of separation in terms of the appropriation. that is one of the recommendations that the review panel did highlight, is the challenges of that departmental agency arrangement. And like, I'm making it really clear and really simple. Disability support services will move to a ministry that is well used to dealing with a large appropriation, complex services, and the critical nature of ensuring we deliver better services. And it also enables Whaikaha as a standalone ministry to look across the government system and to see where those really challenging places are that, quite frankly, some of them have been there for many years, and disabled people are, quite rightly, incredibly frustrated with some of the stuff that still occurs today.
The review found that a big issue was that Te Whatu Water still had the contracts that Whaikaha was having to deal with. I bring MSD into this now, and especially when disabled people say they hate dealing with MSD, that it's a very dysfunctional organisation and actually cruel.
So let me just explain. So the Disability Support Services will be set up as a new unit within MSD, very separate from any other parts of the organisation. There'll be its own Deputy Chief Executive who will run it and look after it. And as I say, we can and must do better. What we don't want to do is waste precious time and energy trying to build a financial system when there's one that we can utilise. This is a system problem. It's a very clear failure. It's had an impact on disabled people, which I won't tolerate any further, which is why I've taken the decisions and Cabinet's taken the decisions, and we're taking urgent action.
Did they not want to take it on? They already have the financial system, it seems, with Whaikaha currently.
Yeah, so let me explain that. So when if you look back at the original Cabinet papers looking at the establishment, and I do think the disabled services were an afterthought. The government was focused on what they were doing with Health New Zealand. There were some options. Did the Disability Support Services stay with Health? Did it go to MSD? Did it go into a new ministry or as a Crown entity? One of the pieces of feedback that is very clear from the disabled community is they don't agree with the medical model, and health really kind of implies that a disability is a medical issue, whereas more people accept it as the social model of disability, which is also where I see it sits better within the Ministry of Social Development.
Can I build on the Minister's response by just saying that it was incredibly challenging having an organisation that was reliant on infrastructure through Health NZ and reliant on infrastructure from MSD. And despite the huge effort that the team went to, the reality is it would all in likelihood have taken us another 2 to 3 years to really build the infrastructure to support disability support services. And disabled people have been waiting so long for change, and it is really, really important that we can make that change as fast as possible.
In that case, is there capacity for the support services to move back within Whaikaha at a future date? Or
That's not envisaged. Obviously, you can't rule out what a future government may choose to do. But what is clear to me is we need to stabilise the system. That means using a ministry that is well used to dealing with the complexity, has the financial systems and controls in place, and we are focused then on how we improve the services that disabled people get.
will the Enabling Good Lives rollout continue in the future, or is that kind of on hold indefinitely?
Yeah, so we've paused it at the moment. It's fantastic, and I know there's great hope and expectation around how disability services are improved for disabled people. But job number one is stabilising the system. And I think that's where we have to keep the focus for now. I do think that over the coming months, as we look at things like flexible funding and the criteria around it, I think we'll see some really clear opportunities for how we do make improvements. And so that's the really exciting part of what we're doing.
In terms of criteria, criteria. There's long been criticism over the split between the way ACC treats different disabilities depending on how disability was caused. Will that be tackled?
It's not my intention that that is included in the scope of the disability support services work that we do from here. It's looking at the 50,000 people that currently access the disability support services. I know flexible funding is so valued by disabled people, so it's just looking at how that's working. Do we need to make changes to it? And as I said, none of those things will change without strong involvement, engagement, consultation, input from the disability community.
One of the really, really important points to remember about enabling good lives is it is a set of principles that was developed by disabled people. And one of its critical principles is that all government services should be able to be accessed on a mainstream basis. So one of the things that the standalone ministry will be able to do is really, really help drive that change across government so that all government agencies make their services, whatever they are, accessible and easy to use for disabled people.
Do you have any concerns about any of the recommendations?
I acknowledge that the sector has been through a challenging year with some of the changes that were made earlier, and what I'm really focused on is leading through these set of recommendations, implementing them well and supporting the community and supporting my staff who will move into MSD, of which a number of those staff are disabled people and want to continue serving disabled people well.
Yeah, do you plan on remaining in the role?
Right now, I am focused on leading the ministry through these changes, supporting our people, supporting our community, meeting the needs of the provider network, and I remain committed to serving disabled people for the rest of my life.
But do you plan on remaining in the role?
Let me explain how that process works, because when you set up a new ministry, which is what we're doing, the Public Services Commission then step into a process around the role of the Chief Executive. So that's what they will undertake.
Right, and so that would happen later this year? Would it?
Yes.
Yeah.
The way that disability support services will be kind of administered when it goes to MSD, will it be the same way that they operate now? For example, individualised funding will be, held within a host agency and there's sort of a claim back process and things like that, or will it be more streamlined, similar to a way that MSD would administer, a job seeker benefit or something like that?
So one of the things that is really clear from listening to disabled people is the system is confusing, it's complex, and there's some real opportunities to simplify it. So what I'm really optimistic about is over the next couple of months with the task force looking at those elements of the disability support services and what improvements can we make. And I would expect that would then create work going forward to make those changes. But as I say, none of those decisions will be made without disabled people. But my goal is to make sure that the services are simpler, they're easier to access, there's greater transparency, and it's fair and consistent across the country. And I think it's fair to say those are some of the challenges that disabled people have talked about for a long time. And they had high expectations when the ministry was set up 2 years ago, that they would see that. They haven't yet, but I am confident we will make improvements. We can and must improve the lives of disabled New Zealanders.
There's a lot of anxiety in the disabled communities at the moment, and a lot of it comes back to this office around the benefit sanctions you announced earlier this week. Now, big changes at Whaikaha. Is this government making life harder for disabled people?
So first, let me sort of draw a line between the announcements that were made on Monday. They were predominantly aimed at job seekers because the government has a target to reduce the number of people on the job seeker benefit. And again, People would say that there was confusion, it wasn't clear about what people needed to do, and so the announcement on Monday was about helping people know what their obligations are. And actually, I would be the first one to say that I think we can do a much better job of supporting disabled people into employment. I don't think we've done well enough in the past. I've made that clear to the Ministry of Social Development because I'm firmly of the view that we should focus on what people can do rather than what they can't. And we are not there yet.
Was it fair, though, to bring people with disabilities into the traffic light system? It's causing a lot of distress in the disabled community.
Yep, so for those with health conditions and disabilities, some of them will be assessed as being capable of working part-time and others won't. And again, it's just making it really clear to people what those expectations are if they have work obligations and the steps they need to take. The important thing here, and I think this is probably a difference between myself and the Minister previous, is I really believe that if someone has a temporary health condition and disability, MSD should be working with them proactively to support them to be ready when their work capability changes. It may well be that we can help them get a driver's licence now. They might not be capable of working for another couple of years, but I don't see why public services should not be available to them to help them towards employment in the future, and that's what I'm committed to doing.
Yeah, but all the rhetoric about the traffic light system is punishing people if they don't, if they're not trying to look for work. You've got a lot of people with disabilities that can't.
So it's a very small number that don't comply with their work obligations, and I think it's really important that we don't cloud the discussion today. I'll say it again, I don't think as a government we have provided great enough access, whether it's in education, whether it's employment, whether it's in transport or housing. I don't think we do a good enough job today for disabled people. That's why setting up a separate ministry is really important, and that is why the Disability Support Service will be contained to look after those 50,000 that need those services. But absolutely, I am unashamedly supporting disabled New Zealanders who can work and want to work, and I will support them in doing that.
Do you think about any changes around, the eligibility criteria for the supported living payment?
Look, that's a separate piece of work. It's not something that's being considered at the moment. What I do know and hear about on a regular basis is disabled people's frustration at having to reapply. So I do think that's absolutely some work I'm interested in doing. But again, it comes back to, what is it that disabled people, their families and carers need, and how do we improve their lives? There is no shortage of opportunities. I'd love to be in a position that is not the case, but unfortunately it is. And I'm really confident that the decisions that we're announcing today will put us in a much stronger position to deliver better for disabled New Zealanders.
So you're interested in looking at that, but it's not being looked at the moment. I mean, when will that happen?
Well, it's not in this next 6 months.
What would you say to people in the community that might feel like this is a loss of representation for disabled people in New Zealand to have Whaikaha transferred into MSD?
So the first thing, just to be clear, at the moment, today, Whaikaha is an agency within MSD. So we are actually taking it out, making it a standalone ministry, which gives it a greater level of independence. And I actually think by having a more single focus on delivering for disabled people and ensuring across government services we do a better job, I think it will be better. I think there's opportunities to look at how that policy work and how that work rolls out. That's a matter for another day. But I don't want any disabled person in New Zealand to think that they won't be included in the important decisions around the disability support service that the task force will look at in the next few months.
Regarding the chief executive process that triggers when the changes are made, does that involve creating a technical vacancy and having to reapply for that vacancy?
So there's a number of measures that the Public Service Commission will consider, and I haven't received any advice on that.
Well, would you reapply if a technical vacancy was created?
There's a range of different processes that have to be worked through, so right now my focus is on continuing to lead the ministry and what needs to happen in the coming months.
When did it become clear to you, Paula, that this the vision of Whaikaha was not going to work out? You said it was going to take another few years probably to get disability support services. How early on did you think this isn't working?
It was really within the second year that it became very evident to me just the enormity of the challenges, and there were so many outdated policies, practices, IT, legacy issues that were part of the system for decades, and those became more evident as the months went on, and the team worked incredibly hard to address as many of them as possible, but the reality is it would have taken another few years to really address them properly.
Doesn't MSD have some pretty big IT legacy issues?
Well, that's a separate issue, and there's some program of improvements underway at the moment around that, but that's very separate from the disability support service work.
Does that not get, given that's going in, well, MSD's running, is that not caught up in the sort of outdated IT that they're running?
No, so the system that will operate the disability support services will continue in the short term, and then that will be a piece of work we'll need to consider in the future.
In terms of the restructure, can you rule out kind of total job cuts?
Well, as I said before, we're not in a position to know that detail yet. A large number of people will be in the new ministry or in the disability support service, and those details will be worked through at pace.
But you can't rule out that jobs will be lost?
Well, it's will be disappointing if that happens. There is a slight possibility of that, but that's not the intention of what we're doing. Absolutely not the intention of what we're doing.
Why have you kept the Whaikaha as a ministry with sort of roles like oversight, monitoring, advocacy? It sounds more like sort of an oversight body like Mana Mokopuna or something like that. Why have you kept it as a ministry and not something different?
Well, if you look at the other ministries, policy advice is really important, and advocacy, and the other one that is particularly important in the disability community is information and advice. That I think is a really important role, as I said before, about the confusion and trying to make things simpler. But a standalone ministry is a really important step, and that's why we're doing it. Sorry, we do have to wrap up now. Thank you all very much for your time. Appreciate it.